Phase 1, first we have T10. It's a trunk active range of motion. First we have a patient here. We're going to ask the patient to kind of step forward. We'll have the hands on the hips, and we'll just do a little bit of extension. So feet are kind of shoulder width apart, just like he has. The next day is forward. You don't want them looking up, and they might fall backwards. So this one they're just looking forward. We're holding for 5 seconds. Then you ask the patient just do a little extra push at the end. Slow breathing. We're not holding the breath, and that's extension right there. Next one, we'll have the patient put one hand on their side, one hand kind of comes over their head, and just have them lean to that one side. Again, not holding them back. 5 seconds, a little extra push at the end. Nice controlled breathing, and then you'll have them go to the opposite side. Go back to neutral, and then tell them to go to the other side. 5-second hold, a little extra push at the end. And a good number starts 5 each way, 5 seconds with the extra push. Next, we have T11, which is seated mid-back rotation. We have the patient sit nice and upright. We'll have them cross the arms in front of them. We have them twist to one side. Hold for 5 seconds. Again, they're breathing through this. A little extra push at the end, and then you have them go back to neutral. And they'll rotate to the opposite side. 5 seconds with an extra push, and then back to neutral. Again, 5 for 5 seconds is a good way to start there. And that's mid-back rotation. Next, we have the prayer stretch. If the patient's capable, you have the patient get on their knees. The idea is kind of have your butt sitting on your legs if you can. Arms are faced forward. Neck's relaxed, it's not looking up. This position, you'll have them hold for about 30 seconds. For about 30 seconds, they can just kind of sit up, relax for a few moments. We'll go one towards the middle. Right now, he's going to the right. So both hands are kind of on top of each other, one side of the table, leaning that way. Go relax, and then go to the opposite direction, left side. Again, you notice how his legs are sitting back on the buttocks there. 30 seconds each way. So that's right, middle, left. You can start out with 20 seconds and work your way to 30 seconds. Next, we have the open book stretch. You have the patient lay on their side. You have a pillow. Your head's just resting on the pillow. Knees are slightly bent, just in a comfortable position. Your hands are right in front of them. Hands are on top of each other. You're going to have them, we call this the open book stretch, which is T14. We're going to open up. He's going to open up with his left. His head's going to follow his arm. Hold that for about 2 seconds, and you can kind of close it nice and slow. Again, don't have the patient hold the breath. You'll kind of notice the face will turn red a little bit. The hips are straight up and down. They're not falling back. Knees closed. And again, you can advance this one 2 seconds to 10 seconds. And then you'll have the patient roll on the opposite side. Same thing. So a good one to start with is 4 to 5 on each side for about a 2 to 3 second hold in the beginning. See his face is following his arm, his eyes are. And that is the open book stretch. Next we have shrug and roll back. So this is without weight. We just have the patient, good posture. You'll have the patient shrug their shoulders up and then just roll back. Nice and slow process, squeezing their shoulder blades together. Same thing. Just advance that patient with reps with that. And there's another angle of that. Good posture. You don't want their neck real forward, just comfortable position. Next we have the just the scap squeezes without the bands. The patient can be seated. Basically, we're just going to squeeze the shoulder blades together. The shoulders are kind of rounded back. He's squeezing right in here. You can tell the patient, pretend there's an orange or something between their shoulder blades that they're squeezing. About 2 to 3 second hold. So that one's pretty easy there. There's another example. He's just squeezing right there. And this is for just the beginning. Just get those muscles pulling together. And next we have the pec stretch, which is T17. In this video, we're just going to use the column on the wall. First one, we're going to do the high. So the patient is sitting upright, Neck is forward, it's not facing down. His arms, if there's 90, he's right above 90 there. He's going to hold that position for about 20 seconds. Then he'll relax. We'll go down to 90 degrees. If you see where his chest and shoulder there, 90 degrees, we'll hold that for 20 seconds. It's nice and slow, controlled breathing through those. And then we'll go a little lower. Again, you see him kind of going back to really get that stretch. Should feel it up in here in the pecs. That position you hold for 20 seconds also. And that is phase 1 of the thoracic spine. Alright, this is still phase 1 of the thoracic spine. This will be T13. This is the column stretch for the rhomboids. Again, the rhomboids are right here in the middle of the thoracic spine. You're going to have the patient hold on to the column there. He's kind of leaning back, and he's just going to twist into that shoulder, that left shoulder there. You should feel that stretch through this area. We would hold this stretch for about 20 seconds. We would switch arms, so 3 on each side. And that is T13, the column stretch, the rhomboids.